More and more children as young as 5 now getting vaccinated against COVID-19 just in time for the holidays. That might sound odd to say that, but that's something a lot of parents have been eager to see happen. In today's KSAT Q&A, we have pediatric infectious disease Dr. Tess Barton from UT Health San Antonio to join us to talk about COVID and children with these holidays coming up. I think the biggest question for a lot of parents who may still be waiting to get their kids vaccinated, curious about what you've seen in terms of reactions for kids who have gotten the shot so far. What's been popping up that you've seen?
So by far the most common things that we've seen are those sort of nuisance reactions, especially sore arms, a little bit of fever, some headaches, some feeling bad for a few days, maybe even missing school for a day or two. I've been working in the hospital and in my clinic, and we actually haven't seen any kids. I haven't seen any kids with myocarditis. In discussing with some of our local pediatric infectious disease colleagues, because we chat once a week, it sounds like there may have been a couple of cases around town, but that's about it. Overall, the experience has been really good.
Again, an explanation for people at home what myocarditis is.
Myocarditis is a type of a heart inflammation that can be caused by viruses or caused by immune system reactions to certain infections. It's something that we see with COVID infection. It's something we see with other viruses, and it's a rare side effect of the COVID vaccine.
And it's not something that's long-term?
No. All of the cases that have been reported from the vaccine have been relatively mild and resolved.
Talk about Thanksgiving coming up, and then of course the Christmas right behind it. How concerned are you that we're going to see another spike in numbers because of so many people gathering together over the holidays?
Well, a little bit. Certainly when people get together, they get together inside. It's getting chilly outside. And I think that, after putting off a lot of holiday activities, a lot of families delayed it last year or scaled it down. And I know everybody's really eager to get together. So, there is a risk when you get people who don't have any immunity yet in a group setting with their faces uncovered, laughing and hanging out together, that there's a risk of transmission.
But, this time last year, people weren't vaccinated, not nearly as they are now. So, we had advice about only sticking to your family unit. If you're having people together, space them out in the driveway on, folding tables and things like that. So are you thinking that, how much of a role will the vaccine play in whatever kind of increase we do see after Thanksgiving?
So I think, we're all hopeful that actually maybe we've reached that magical point of population immunity that we won't see quite the same surge. Who's left to be vaccinated are the young people, right? The kids. So they're the ones who has just become available for them. We're doing great in San Antonio, actually, with our adult vaccination rates, and especially for older people. But we know the vaccine's not quite as effective in older people as it is in younger people. So getting those younger people vaccinated will help to protect the older people, at Christmas, so they can go hang out with grandma and grandpa at Christmas.
And that's what I want to talk about, the timing. Is there still time to be vaccinated before Christmas?
There is. So the vaccine doses are 3 weeks apart. So we're, 1 week away from Thanksgiving. You get a little bit of immunity after the first dose, but you really get your robust immunity after the second dose.
So there's still time to be fully vaccinated before you go to grandma's house.
Absolutely. I would start it this week.
What do you tell parents who are still waiting? They're still thinking about it. It's something they're interested in, but they just haven't done it yet.
I totally understand, right? Because this has been a really unprecedented timeline for getting a vaccine. What I can say is that between the clinical trials that show us that this vaccine is extremely effective and very safe, and our huge clinical experience of hundreds of millions of people who have been vaccinated around the country, including teenagers, is that the safety profile of this vaccine is very good. And so I think that the benefits of getting to a level of immunity where kids can get back to their regular lives and where families don't have to worry about who's at home, who might be vulnerable to getting infected, is really great. And so I say, the experience has been good. Talk to your pediatrician, get advice, But don't wait until we have another surge. Don't wait and take your chances on hospitalizations and more deaths.
I know you're probably sick of answering this question, but it seems like everybody that doesn't get the vaccine is at least using this as part of the excuse. Aaron Rodgers, the quarterback for the Green Bay Packers, who just came down with COVID, used it as an excuse. Is there any evidence that these vaccines cause infertility?
No, absolutely not. We actually know this from a lot of different things. So from clinical trials and actually for some other interesting trials in young men and in women. So there's no evidence that the vaccine impacts infertility. The vaccine and the disease can both impact women's menstrual cycles temporarily. But there were plenty of pregnancies that have occurred in vaccinated people. Sperm counts are good in men who have been vaccinated based on research studies on that. So no, there's no evidence that there's any infertility problems.
And even pregnant women are encouraged to get that booster whenever they're pregnant, at any point in pregnancy. It's been very important to see that happen. Dr. Tess Barton, always appreciate you sharing some time with us. We hope you have a happy Thanksgiving, and thanks for being here tonight.
Thanks so much.
Thank you, Doctor.